and today we're gonna discuss introduction in microbiology. So, I guess that's clear what is microbiology, right? At least in general terms. It is a study about micro lives, or everything that is related to life. Because as soon as you will start learning something about different types of microorganisms, you will realize that not all of them are actually organisms. For example, if we compare bacteria and viruses, bacteria are organisms and viruses are not. Why? We will discuss later. But still, even if viruses are not organisms, they are related to living forms. This is why they are making also part of this science is microbiology. And basically, microbiology is divided in three main directions: bacteriology, virology, and mycology. And here's the question: how do you think which types of these microorganisms, so-called, are the mostly numerous in the world? Viruses, bacteria, or fungi?
Bacteria.
Okay. On the first place, most of you decided to put bacteria. On the second place, viruses. And the last place? Could you explain your logic? Bless you. Could you explain your logic? Why do you think exactly in this order?
Bacteria exists in a lot of places, like good bacteria, bad bacteria. A lot of it can be seen everywhere. So it's
I could say same thing about viruses and fungi. We have good and bad ones.
Bacteria can divide faster, which leads to more of it, and it can survive in really harsh conditions, yet moderate conditions, and it's basically everywhere. So it's easier to divide. Since it's easier to divide, like a lot of them there compared to viruses or fungi.
Sounds fair, but at the same time, sounds to be very general statement, because if you say that bacteria multiplies faster, you should be more specific, because we have a lot of different bacteria, and some of them actually are dividing with the speed 1 division per minute, and others you will be able to multiply them in best conditions in the lab more than 1 month it will take. So, and if we take an average period of multiplication, you will find out that probably viruses are multiplying faster from this point of view. If we are talking about average. If we are talking about specific bacteria and specific viruses, maybe. Okay, other arguments? Other ideas?
Viruses always need a host to survive. And
Good, very good. Most of viruses, not most, all of viruses, they need the host cell in order to multiply. This is extremely important part of the statement, host cell, because viruses are strictly intracellular parasites. When we are talking about bacteria, now it also depends. Some of bacteria, they don't need anything like specific. It can be a host organism, it can be environment, the environmental factors could be different, but some bacteria will survive only in the host organisms. And some of them are also, like viruses, will survive only in the host cell, because some kinds of bacteria are strictly intracellular parasites. And when we're gonna discuss about those bacteria, another question gonna be, what's the difference between those bacteria and viruses? But it is what we're gonna discuss later. Other ideas?
Bacteria mostly can make their own food because they are heterotrophs, autotrophs. And also they are present in many food substances also, like lactobacillus bacteria in milk.
Okay. This is what explains why bacteria are actually living organisms and viruses are not. Because they have their own metabolism. They're able to do everything on their own. Okay, good. So indirectly it could explain somehow. Now let's go to the simplest way ever to try to figure out finally which of them are mostly numerous in the world. By a simple logic. For how many times in your life you've been infected with viral infections? A lot. And when you say a lot, that means that you cannot, it's kind of countless even for you, right? You are not really sure for how many times in your life you've been infected with viral infection. That much, right? You can appreciate somehow it was maybe like you take your age, if you're 20 years old, you say something around 20 times. Plus or minus 5 maybe. And it will give you kind of average amount of times for how many times you've been infected with viral infection. Fair? Okay. Now try to remind for how many times you've been infected with a bacterial infection in your life. And here, if you say 1 or 2 or 3, probably you are not really aware about what is bacterial infection. Probably. Because, did you ever have pimples on your face? Each of them is bacterial infection. It is not generalized, like you don't have fever, you don't feel bad. But it's a problem, right? Especially if you're a teenager, if you're starting looking around, and you start thinking that everyone is looking at you, right? It bothers and it hurts. And it has all 5 signs of inflammation that is characteristic for infection, right? You know all of those five signs, right? But it is localized. Even if it is small, it is localized. So, only starting from this small event, you can say countless times of infections in your life. Okay, did you ever have food poisoning? Yes. For how many times? A lot. All of us, we had it. Not that much as viral infections, right? As flu or COVID or something like that. Not that much. But still, you cannot really appreciate for how many times you had that food poisoning or intestinal infection, we call it. It is also and in most of cases, it is a bacterial infection. Okay, so sometimes it can be viral infection, for example, rotavirus or something like that. But in most of cases, it's a bacterial infection. And sometimes it is a poisoning. What's the difference between infection and poisoning? In case of infection, the bacteria gets in your intestinal tract, starts multiplying there, maybe producing some toxins and so on. And this is what produces this inflammatory process in your intestinal tract. But some bacteria are multiplying in food. They produce some toxins in food. After that, they are dying also because of their own toxins. And when you consume that spoiled food, full of toxins, there is no inflammatory process in your intestinal tract. But actually, it is direct intoxication. So in the infectious process can have place also intoxication, because a lot of bacteria are producing toxins. But this intoxication will be part of the entire inflammatory process we call infection. But in case of food poisoning, there is no inflammatory process itself with all the stages, but only that food poisoning, that intoxication with a toxin, because bacteria is not multiplying anymore in your intestinal tract. Okay? And for how many times in your life you had fungal infections? First of all, most of you could say, I guess never. And here, again, probably either you're right, and you didn't ever have a fungal infection, either you are not really familiar with examples of fungal infections. Did you want to say something? Yes, because you've been, okay. And based on this reality in your life, I promise you it is not only your reality, like we selected here only those who had this incidence of viral, bacterial, and fungal infections. For most of the population on the earth, we have the same reality regarding infections. And based only on this one, we already can suppose that viruses are more numerous than bacteria, as species, as infections, and so on. But that's true that, first of all, not all of them are known for science. And not all of them are infectious, like harmful. And another reality is not everything that is non-harmful, we're gonna study it. Because we simply don't have time for that. Maybe we should study them, all the bacteria we have in the world, in order to know how to use them better. Because non-harmful bacteria are very useful. Did you ever think about what we would have in nature if saprophytic or normal flora bacteria wouldn't exist in nature? Did you ever think about it? Because saprophytic bacteria, why it is called saprophytic? Saprophytes. Because sapros in Greek means rotten or decayed material, decayed organic substance. Actually, they're responsible on circulation of the entire organic mass on the globe. So if we wouldn't have any saprophytic bacteria, by the way, some of fungi also have this function, decaying of organic substance. Dead bodies of animals, humans, plants, the entire flora and fauna would stay like it stays after death without any changing. Do we need it? Not really. We need circulation of all substances in nature. Just as water. Water that circulates in my body a few hundred years ago were circulating in the body of another person, maybe, or animal, whatever. So it is, and the same thing about substances and energy. Energy doesn't appear from nowhere, and it doesn't disappear in nowhere. That's fair for everything in nature. Okay. The first part of our studying will be bacteriology. Even if viruses are mostly numerous in nature, as well as we know, maybe we don't know everything, but as long as we know, as much as we know, viruses are more numerous, bacteria on the second place and fungi on the third place. This is what we know. Maybe one day we'll discover something else. But even if it is so, we study more bacteria for more reasons. First one, if you will pay attention how all the infections are evoluting, you will observe some similar things in most of viral infections and in most of bacterial infections. For example, fact that most of viral infections will pass themselves, right? What does it mean? It doesn't mean that you shouldn't treat viral infection, but actually it means that for most of viral infections, symptomatical treatment is enough. If you have a flu, you have some specific symptoms. Fever, cough, more symptoms from nose, not from throat or lungs. So running nose, sneezing, weakness, muscle pain, and so on. If you don't treat it well, the coughing can start, right? And bronchitis can start, and pneumonia can start. But it will be bacterial complication or bacterial superinfection. In the beginning, it is a viral infection that affects upper respiratory tract, and after that, it is bacterial infection if you don't treat it well from the very beginning. If we compare it with coronavirus infection, a little bit different because coronavirus prefers more lower respiratory tract, not upper. And this is how you can differentiate. But still, we can have some exceptions. And this is what actually makes coronavirus and COVID to be a little bit more aggressive, because it leads to pneumonia much faster. As soon as you have pneumonia, we have decreased function of lungs, we decreased oxygenation of the entire body, and our organism is not that able to fight anymore with infection. This is what increases so much complications, severe forms, and mortality in COVID. But it is, if we talk in comparison with flu, that has mortality under 1%, lower than 1%, and COVID that has mortality between 3 and 5%. Still, 3 and 5% is not too much if we're talking generally, or if we compare with other infections. But it is extremely too much if we compare with the flu, or something like flu. And you can observe that even in COVID, in most of cases, symptomatical treatment is going to be enough. Did you ever have flu? Yes. How did you treat it? Paracetamol, Theraflu, some tea, and very good if you applied isolation, outer isolation, and rest. The mostly ignored part of treatment. People do ignore treatment of flu and of other respiratory tract infections with rest. Meanwhile, it is one of the mostly important symptoms. And if you don't treat all symptoms, at least you will recover much longer. And tiredness in flu and in other acute respiratory viral infections is one of the most important symptoms, tiredness. Are you treated? In most of cases, you do not. Because you don't want to get absence, right? Because it is very complicated to obtain medical certificate in order to not pay that absence, and so on and so on, so on, so on. And you extend your own issue on others, on your colleagues, on your teachers, on the entire university. This is why we have every year, especially in the cold period, we have that much viral infections. Because people decide to extend their own issues on others. That's not fair, okay? Talking about bacteria. In most of cases, it is extremely complicated to escape bacterial infection without antibiotic treatment. And this is the difference between symptomatical treatment, as we've been discussing in comparison in framework of viral infections, and etiological treatment. So when we are talking about etiological treatment, it's fighting against cause of infection. In case of viral infection, we also could have etiological treatment. We treat with antiviral drugs, right? In case of bacteria, antibacterial drugs or antibiotics. In case of fungal infection, antifungal drugs. Very easy. So in case of bacterial infections, in most of cases, it is extremely complicated to escape bacterial infection without antibiotical or without etiological treatment. It doesn't mean we shouldn't treat symptoms. We should treat symptoms. But this complex treatment, etiological and symptomatical, they together are giving more efficiency. This is why on the first place we'll have bacteriology in this subject. On the second place, virology, and the last one, as less studied, and I should recognize I don't know mycology that much, I know it in extremely general terms. This is why as soon as you will have some questions regarding mycology, some deep questions, there is a high chance for a lot of cases I will tell you, excuse me, I'm not really familiar to that. That's the reality. I prefer to be truthful. But when we are talking about bacteriology, please, whatever you want to ask, I'm almost sure, in most of cases, I will be able to provide you with the necessary response. Okay. So, let's start talking about bacteria. Before we start talking about bacteria itself, it is important to keep in mind such term as taxonomy. What is taxonomy?
Study of giving name.
It is study that gives you more information about naming, about scientific naming of something. When we are talking about bacteria and most of living organisms, overall, it starts with domain, kingdom, phylum, class, order, family, genus, species. For me personally, it took a few years to keep that in mind. But don't worry. First of all, you don't have to keep that in mind. I should, you shouldn't. But for you, it's gonna be extremely important to know at least genus and species name, and sometimes family, genus, species. But in most of cases, genus and species name. That's enough. For most of doctors, that's enough. for microbiologists, it is extremely important to know more, at least for show off. Okay? At least. And if you are a nerd and you love to investigate more, also for another side of your own inner satisfaction. So, for most of doctors, that's enough to know genus and species name. And here I would like to give you some clues how to keep in mind a huge amount of information regarding microbiology without learning. Do you like it? Do you want it?
Yes.
The biggest issue ever each student had is how to keep in mind everything without learning, right? First of all, the easiest way to keep everything in mind without learning is being a nerd. If you are not so, bad news, for you it's gonna be a little bit more complicated. Second, but still it is not the end of the world. Next, if you are not nerd, but you want to know something and you want to make your journey a little bit easier, you should try to find the way how you're gonna like it. Because I promise, first, you will not like even half of all subjects in this university, and you shouldn't. Even if becoming a doctor is a dream of your life and of your family, of everyone around you, more than half of subjects you will hate, and probably you are already, right? Of course, I remember how it is. No problem. It doesn't mean medicine is not for you. Maybe, if you hate everything, probably it's not for you. So think twice. It is not too late to change your mind yet. Losing 2 years is not losing 10 years. So, think about it. It's very important. So, now, if you're sure that you want to become a doctor, you must find a way how to make each subject a little bit more interesting for you. As soon as it will become more interesting for you, it will become easier to learn without learning. It should be interesting for you. Like, I have some special abilities others do not have. And others have some special abilities. I'm looking, wow, how you've been able to do that. And that person is like, I don't know. It comes itself. Why? That person likes it. And thinks, I can do good. I like them. And rest is hard work. So if you are waiting that somebody will come and give you one key for all solutions, come back on the earth, you're gonna work. And if you think that medicine is extremely exciting, full of action and full of adrenaline, come back, it's extremely boring. In most of cases. And sometimes you feel yourself hero. Sometimes. Even microbiologists. Can you imagine? I've been surprised. But it is not every day. Of course, some specialties have more action, like ICU doctors, like surgeons, and so on. But even they They have more boring stuff to do, not interesting. So you should consider it. It's extremely important. Because if you are coming here, white coat, having that mop, making a smart face, talking with a lot of terminology, complicated that no one can understand you. Like after watching Dr. House TV show, right? Did you? Of course. Of course, me too. But it is not like that. It is not like that. In most of cases, it is not like that. I better disappoint you now, and when you become a doctor, you will say, "Oh no, it's much more action than he told us," instead of backwards. You know. So, coming back to boring stuff. Okay. So, coming back to boring stuff. Taxonomy. What is interesting about taxonomy in microbiology, that most of namings in microbiology are extremely informative. Extremely informative. And basically that's enough to keep in mind few words and few shapes and few structures and to connect them. And after that, you're gonna be able to give much of responses on questions. For example, which kinds of shapes you know in bacteria? Spherical shaped bacteria, comma shape, spiral shape, rod shape,
disc.
Okay, most of them are related to spherical shape. And at least one more, amorphic or polymorphic bacteria with irregular shape. Okay. Now, talking about spherical shaped bacteria. Probably you know that most of them are called cocci or cocci, right? Right? Good news. As soon as you can hear in the name of bacteria, and here please keep in mind, most of this information is about genus name. Genus is going before species name. Genus, species. So genus name is extremely informative regarding shape, bacterial structure, and so on. If you can hear in a genus name the root coccus, you already know it's spherical shaped bacteria, right? And here I ask you, Streptococcus, Staphylococcus, Diplococcus, Tetracoccus, Micrococcus, Monococcus, with one exception, Sarcina, also spherical shaped bacteria. So you already know it's spherical shape, right? Another part of the genus name, also informative. For example, strepto means chain. Staphylo means grapes or clusters. Tetra, diplo, mono. Sarcina, here you use imagination and associations with other things. For example, how I kept that in mind, in Romanian, the word sarcina, do you know it? Sarcina, has two meanings. First one, pregnancy. Second one is burden. or extra charge. Okay? Now, when we are talking about Streptococcus and Diplococcus, they are arranged in chains, spherical shaped bacteria arranged in chains or in pairs. What does it mean? They are able to multiply only in one dimension, in one line. When we are talking about Tetracoccus, they are able to divide in two dimensions, in two lines. This is why they're arranged in cluster, each of them in groups of 4 bacteria, in 2 directions multiplying. Sarcina is multiplying in 3 dimensions, on 3 lines. This is why they will produce kind of cubic shape. And since they are 3-dimensional, they are not flat, they are 3-dimensional, they have extra burden, they have that pregnancy, so-called. You can keep in mind Sarcina is 3-dimensional multiplying bacteria. And Staphylococcus means grapes, clusters. They're multiplying in any possible direction. And they're arranged in clusters like grapes. So that's enough for you in order to keep in mind Staphylococcus, Streptococcus, Diplococcus, Tetracoccus, Monococcus, and so on, right? So if you see that bacteria, you are able to name it. If you read the name of bacteria, you are able to describe its shape and its arrangement, right? Okay, rod-shaped bacteria. Rod-shaped bacteria are divided in three main groups. First one is bacterium. Please don't misuse bacterium with bacteria. Bacteria is general name for all prokaryotic unicellular microorganisms, bacteria. When we are talking about bacterium, it's a rod shape, gram-positive, one more information, non-spore forming bacteria, bacterium. And here, I tell you, Mycobacterium tuberculosis. It's a pathogen that causes tuberculosis. Mycobacterium tuberculosis, which shape has? Rod shape. Is it gram? It's gram-positive. Does it produce spores? No, it doesn't. So, by the genus name, you already know that Mycobacterium tuberculosis, from the root bacterium in that name, you already know its shape, its kind of structures, and so on. And why it is called myco, not micro, not mio, and so on. Very often students are misusing. Myco is from mycolic acid. Mycolic acid actually is a wax. And it covers Mycobacterium tuberculosis and gives it resistance to acids, to alcohol, and so on. This is why it is acid-fast or acid-resistant bacteria. So from this information, this is what I told you. Genus name is extremely informative. Corynebacterium diphtheria. Again, diphtheria. Species name gives you information about the name of disease in most of cases, but genus name about structure of the pathogen. Corynebacterium diphtheria. And you will observe that in Corynebacterium, on 2 sides, we have some structures like granules, volutin granules, that are source of energy. Plus, please don't misuse them with spores. Spores are not arranged in pairs, and in most of cases will look transparent. But volutin granules will absorb dyes much better than the bacteria itself. So you already know it is gram-positive, rod-shaped, non-spore forming bacteria. Another type, it is first one, bacterium. Second one, Clostridium. Clostridium is rod-shaped, gram-positive, spore forming, with a spore that has diameter bigger than diameter of the cell itself, and it deforms the shape of the cell. Spores in Clostridium can be situated terminally, subterminally, and centrally. And it will deform the shape of bacteria in that specific place. So as soon as I tell you Clostridium tetani, Clostridium botulinum, Clostridium perfringens, and so on, you already know how it should look, apparently. I give you the name, you can draw it. Okay? Or you can see it, you can give me the name of genus. Bacillus is the third kind of rod-shaped bacteria. Bacillus is, again, rod-shaped, gram-positive, spore-forming, with a spore smaller than bacteria, and it doesn't deform the shape of bacteria, so the bacteria will stay, will keep its own shape with that spore. So I tell you Bacillus anthracis, and you already know. It's gram-positive, it's rod-shaped, it's spore-forming. And what happens next? As soon as you can see this bacteria, you can tell me it is Bacillus. As soon as I tell you Bacillus anthracis, you know how it looks, and probably you can tell me which infection it causes, right? Which infection it causes? Anthrax. Okay? Spiral-shaped bacteria. Most of them are called spirochetes. Makes sense? Makes sense. Spirochetes are spiral-shaped bacteria. But when we're talking about genus name, most of them you need just to keep in mind. Treponema is spiral-shaped bacteria. Treponema pallidum is causing syphilis agent. Borrelia is spiral-shaped bacteria. It causes Lyme disease, it causes borreliosis, spiral-shaped bacteria. You keep that in mind. And Leptospira. This genus name gives you a suggestion it's spiral-shaped bacteria, Leptospira. Okay. And also you keep in mind it is a pathogen that causes leptospirosis. Makes sense. Now, one more thing that will make your life much more easier in terms of microbiology. That huge problem of gram-positive and gram-negative. What is this? Why do we need to know it? How to differentiate it? Most of students can keep in mind only the fact they think that gram-positive bacteria is purple and gram-negative bacteria is red or pink. And usually you stop on this level, and overall that could be enough for you if you're not becoming microbiologists. But why do we need to know if the pathogen is gram-positive or gram-negative? Raise your hand who wants to become microbiologist. Very good. Awesome. All the time we have the same result. I'm so happy about that. I keep this place for my children. No problem. We don't need competition. So probably you can see yourself in the future near patient, right? not under the under the microscope, above the microscope. Okay, as a doctor who prescribes the treatment to the patient, why should you know is it gram-positive or gram-negative? And this is the clue in my question.
To identify.
Because for treatment, in some cases, you don't need to know the name of bacteria. But it is important to know is it gram-positive or gram-negative. And to know symptoms in order to prescribe a proper treatment. Because the main difference between gram-positive and gram-negative bacteria is not color, because all of them are initially colorless. And the response you get when you apply staining to bacteria indeed is purple and pink in gram-positive and in gram-negative. But we don't care about the color, we do care about cell wall structure, because most of antibiotics are fighting on the level of the cell wall. If the antibiotic is not able to penetrate the cell wall, it will not be able to destroy the bacteria. And the cell wall structure in gram-positive and gram-negative bacteria is that different, so most of antibiotics for gram-negative could be useless for gram-positive and backwards. This is why, as future doctors, for you it's extremely important to make difference between them, to prescribe a proper treatment. And it is much easier than keeping in mind all names of bacteria. Because I don't learn names of bacteria by purpose. Overall, by an accident. It is not an accident I'm working here, of course. So actually, I learn them because I face them daily, not in purpose. Salmonella, it doesn't work like this. Okay? So, the cell wall structure, difference between cell wall structure of gram-positive and gram-negative bacteria, you will observe that difference is thickness, amount of layers, type of layers. And results of staining will only underline these features of bacteria. So on the practical part of your lesson, of microbiology lessons, you will discuss more with your teachers all of these structures. But for the very beginning, to help you to surprise your teachers, how good you know difference between gram-positive and gram-negative bacteria, please keep in mind. How you keep in mind which one is gram-positive and which one is gram-negative. Again, you take genus name, that is extremely informative, keep that in mind. And you look at the end of the word. If you can find there A, letter A, that's gram-negative bacteria. Anything else is gram-positive. It's available in 98% of cases. What does it mean? We have some exceptions. What does it mean? That means before you learn it, you check it. Okay? So I give you examples. Staphylococcus aureus is gram-positive. Streptococcus pyogenes. Mycobacterium tuberculosis. Clostridium perfringens. Escherichia coli. Genus name, not species name. Escherichia coli. Salmonella typhi. Shigella flexneri. Klebsiella pneumonia. Vibrio cholera. Exception. Now, how you keep in mind exceptions? Associations. Vibrio cholera causes which infection? Cholera. Very easy, because species name is extremely informative in terms of infection, right? So, Vibrio cholera is an infection that causes cholera. Cholera is an intestinal infection, right? Give me a few other examples of intestinal infection. Salmonellosis, shigellosis, escherichiosis. Did you hear about it? I guess you heard about it, right? Typhoid fever, salmonellosis, shigellosis, escherichiosis. All of these are intestinal infections. All of these are caused by gram-negative bacteria. Escherichia, salmonella, shigella, vibrio. So you put them in one group, and you keep in mind that most of intestinal infections are caused by gram-negative bacteria. As soon as you come to Vibrio cholera, you don't look at the genus name and at the absence of A in the end. You look at group of intestinal infections. This is how you keep it in mind, how you keep in mind exceptions. Not that complicated, right? So as soon as you are coming on the lesson and you start describing some bacteria, and by chance you say it's gram-positive, it's gram-negative, and you teach, wow. They know what they're talking about. I should learn better. Okay. Well, what I wanted to specify that I assume that microbiology is not the most exciting subject in the world. Moreover, I assume it's for nerds, mostly. I'm so proud of this degree of nerd. And I assume that there are a lot of important subjects. This is why I am doing my best to make this boring stuff a little bit more interesting, to make it having more sense for you, because finally you will understand that even if it looks not really therapeutical subject, it is related so much to therapy. And you will observe that most of diseases we are passing through in this life are infections. And even if, by chance, happy or not, you will not ever become a doctor, it could happen. Unfortunately, probably you will become doctors. Or fortunately. It depends on you. But if you will not, there are a lot of things that are important for you as human beings to be able to make difference between extremely general stuff. Most of people are not able to do. To be able how to approach some health issues, you're gonna have in your families. Because I don't know how aware you are about this fact, but I want to make you aware about this. Even if you almost don't have any chance to not graduate this university, for a lot of reasons, there are much more chances for you to get family and children than to graduate this university. Did you ever think about it? I'm serious. I'm serious. Did you ever think about it? Much more chances to make family and children than to graduate this university, even if you don't have any obstacles to not graduate it. So, and for how long you are preparing for that event in your life? Huh? Why this? I'm wondering why this good and important subject provokes that much laughing. Except the fact it sounds funny in the very beginning and it doesn't when you get in the tough reality of this life. Think about it. Think about it because if you will be truthful to yourself and to each other, you will realize that most of families in this world are made by an accident. That sounds extremely funny when it is not about you, right? And most of children in this world are made by an accident. That is also funny when it is not about you. But this is the reality. Can you approve it? Can you approve this reality? Or you think I have rich imagination? No? Am I right? So think about it. Because if you are thinking about it only as a funny statement, there is a huge chance this reality to become yours. And still, it is funny now. It will not be funny there. Okay? Do your best to use everything you can use and to get and to obtain everything you can obtain from this university, from this department, from this subject, and from anywhere in order to make it useful in your life. For yourself, for your family, for your children, and for your patients. It was our first lecture. Wish you good luck and see you next week.